Hi, everyone. Welcome to the SelfCare Forum podcast. My name is Dr. Cedric Batchatu, your host for the hour. We bring knowledge to empower you and address the root cause of disease. Our goal is to interest you in the care of the human frame, in diet, and in the cause and prevention of disease. Today, we're joined by none other than Dr. Indy Jones. Dr. Jones is a board-certified internist and practices hospital medicine in the greater Atlanta area. She's also a wellness coach for women, an author, educator, and motivational speaker. She offers one-on-one and group wellness coaching services. Dr. Jones is the author of a 5-star book titled Healthy Living for Women, which is also on the list of the top 100 books on healthy living according to Book Authority. When not functioning in one of her professional roles, which promote health and wellness, Dr. Jones is outdoor hiking, traveling, and spending time with family and friends. Dr. Indy Jones, I want to thank you for joining us here on the SelfCare Forum podcast, and welcome.
Thank you. Thank you for having me.
Awesome. The pleasure is all mine. So I always like to start by knowing what inspired people to begin their journey into health and wellness. So I want to learn a little bit more about you. What inspired you to begin your journey as a physician?
That's a very good question. And it's an interesting one that I didn't have a very clear answer when I had to write my essay to get into medical school. And the only thing that I could say is that it was God. It was a God-inspired dream. I was maybe 5 or 6 years old, knew I wanted to take care of people. I didn't have any role models. I didn't see anyone that looked like me on TV, no physicians in my family. And so I knew that it was something inspired by God. It was always what came out of my mouth when I was asked, what do you want to be when you grow up? A doctor. So that is actually the truth. No other tangible reason or experience other than it was planted in my heart and it had to be from God.
Amen. Now, what about becoming a board certified internist? Why that specific field of medicine as opposed to the many other specialties that are available for physicians?
Sure. Well, I thought about specialty. So as an internist, I went that route. It was between that and family medicine, but I went the route of internal medicine because it's broad enough that after my 3 years of residency, I would have the opportunity to do further training in a subspecialty. But all subspecialists in the general field of medicine are internists first, and then maybe they'll do a fellowship in GI medicine, lung, or pulmonary cardiology, all those things. So at one point, I thought I wanted to be a cancer doctor, an oncologist. I thought I wanted to go into GI because of some personal health issues and issues in my family. I had all kinds of things that piqued my curiosity in those fields. But at the end of the day, I said, I'm too nosy and I want to know a little bit about everything and treat a little bit of everything. So after my 3 years of residency, I said, I'm ready to go ahead and practice, general medicine. And that's pretty much it, knowing that I would have the option to go back and train further. But again, my passion, it fits my passion and purpose that I have now of treating the whole person and not just one particular aspect of their health and well-being.
Awesome. And where are you? Where did you graduate from? Where did you go to school?
So I'm from Buffalo, New York, and I did attend the University of Buffalo for my undergrad degree, my bachelor's degree in biology. And then 10 years later, there was a gap. I applied to one medical school. Again, that was God. It was his timing. No one in their right mind would do that. But I applied to one medical school, the University of Buffalo, and that's where I did my training. And then I wanted to get to more sunnier state. And I heard North Carolina was a good place for other reasons. So I went to ECU in East Carolina for my 3-year residency. And then I wanted even more sunshine and other opportunities and culture and what have you. So I headed further to Georgia, and I've been here for the last 14 years.
Well, amen. What a journey.
Yes.
Now, Dr. Jones, the theme of today's podcast interview is Guide to Healthy Living. Mm-hmm. And we know that you're a traditional physician, but I want to talk a little bit about the transition which takes place to get you to go from traditional or conventional medical practice to the wellness seminars and courses that you offer? What
Yes.
inspired you to sort of take a step to the side and focus a little bit more on wellness?
Well, as an internist, I'm practicing in the hospital setting. I'm seeing people who have typically come through the emergency department, and the emergency room physician has determined that whatever's bothering them, they weren't stable enough or wasn't a good idea to send them home. So I would get called or someone on my team to admit the patient and then follow that patient in the hospital course, day to day, make decisions about how well they are they ready for discharge? Are there more tests to be run? Are there specialists to be called in determining when, the timing for a safe discharge, either home to rehabilitation facility? So even though it's not primary care, over the course of the week, I get to know these patients and spend a little time, at least I try to get to know a little bit more than what brought them in.
Mm-hmm.
So I'd have conversations about the level of stress, what's going on in your life, because many times there's some form of self-neglect, things conditions they knew they had that they weren't taking care of, or just being totally unaware because they don't go to the doctor. So various scenarios. And because of that, I said, there needs to be a little bit more emphasis on what we can do to be proactive about our health, preventative health, maintenance, and all those things. And I realized that a lot of it has to do with mindset, emotional intelligence, if you will, being able to process emotions, because a lot of times it's an emotional decision to either not do something you should, or maybe do something that's a little against health and wellness, you know what I mean? Coping mechanisms, whether it
Yes,
be
yes.
alcohol, pain pills, addictions, and not always that, but just other things, or just neglect. I'm too busy. I didn't go get my colonoscopy, and now they're seeing me and I'm determining that they have colon cancer. So various things where I see I want to make a bigger difference. And God put it in my heart. I knew years ago that there was something else that, again, was in my purpose in this chapter or season of my life. I didn't quite know what it looked like, but it evolved over time and became more and more clear to me. Women are more inclined to do self-help stuff. Although I have no patients in the hospital, but I do cater to women in the wellness arena. And of course, I'm a woman, so I definitely can relate to them in a little more specific areas here and there. So that's pretty much what sparked my decision to put some emphasis in that area.
So the nice thing is, it seems to me like you get to see what brings them to the hospital as a physician. You get to see some
Right.
of the root factors or root causes that actually brings them to the hospital. So, as a physician, as well as a wellness coach, what do you see as some of the major contributors to patients, having poor health or less than optimal health?
Okay, one important thing is diet. The Western diet, processed foods, fast food, microwave food, all those things, not really having a health and wellness plan, which is what I talk about all the time, like planning to be well. You're just not well unless you have an intention to be well, and you take the steps to educate yourself on some things and, just try to eat a healthy diet. So basically diet and movement or lack thereof, which often leads to obesity, which increases the risk of other chronic diseases like hypertension, diabetes, high cholesterol, or hyperlipidemia, which in turn, if not controlled, will put you at increased risk for having a stroke, having a heart attack, heart failure, kidney failure, ending up on dialysis. So those are the three, I call it the triple thread or the first cousins in general medicine, especially with me seeing I see young people and middle-aged and older people, but as we get older, even without a family history, which is very important, just the fact that you're living longer, your risk for certain things is a little bit higher than when you were in your 20s.
Mm,
Mind you, I see 20 and 30-year-olds who have some of these disease processes that are supposed to be for old people. I
yes.
myself personally have hypertension because it runs very strongly in my family, both my parents and my 5 siblings. I'm the youngest of 6. So I could see what everything that was going on with them and say, oh Lord, I hope this doesn't hit me. Right. And so I've done all that I did all that I could to try to avoid it, but it caught up with me. Nonetheless, it's not something that I can't or don't manage, but it makes me appreciate the importance of wellness and preventative health all the more because it applies to me just as it does to my patients or my clients.
Wow. Thank you for sharing that. Now,
Mhm.
you're also an author, having written a book called Healthy Living for Women. It's more than meet the mind. What
Mhm.
was the inspiration behind or the intention behind writing the book? What message are you trying to put out there to people?
Again, that subtitle, it's more than meets the mind. That's where it all starts. So anything that we are or we want to be, particularly in the area of health and wellness, it starts with your mind. It starts with making a conscious decision that I'm going to do everything I can to be well. So many times we, again, want a quick fix, a fad diet, but we're not addressing our mindset. We're not addressing things like emotional eating. We're not addressing the whole mind, body, spirit connection. So I always approach health and wellness with starting with thoughts, emotions, mindsets. And then if there's some rewiring, if you will, which 9 times out of 10, there is some of the brain, meaning, we think a certain way, we have certain habits, our body, our mind, our brain rather gets used to certain addictive things and foods and what have you. So we have to make up in our mind that we want to make a change. We want to adopt a healthier lifestyle. And, you have to be ready to change and ready to execute the plan that you design, and hopefully with the help of someone like a coach, myself, or your primary care physician. So the intent was to help people become more intentional and start with
Mhm.
your thoughts and your emotions and see how they impact. Because again, you can follow a prescription or something that the doctor tells you, but if you don't really buy into it, it may not last long. You may do it for a little while and then fall off. In medicine, we call it non-compliance. So we say the patient's non-compliant. It could be some extenuating circumstances,
Sure.
finances, socioeconomic, lack of insurance, and we get all that. But many times there's just the cares of the world and the busyness of life causes women and men to not give themselves the attention that is so vitally important, not to just living, but thriving. We don't want to just exist, we want to thrive.
Amen to that. So I want to press you a little further on
Sure.
this thing you mentioned, the mindset aspect of things. As an African
Yes.
American, I have spoken to many churches, and I
Mhm.
noticed something. There is a difference in mindset, especially within our community,
Yes.
compared to, let's say, white Americans or many other communities. And so I want you to maybe shed some light into some of the beliefs that we hold on to that may be negative, or they're not conducive to having optimal health.
Sure. I think sometimes there's a lack of trust with health care. And if you say your doctor is someone of the same ethnicity or someone of the same sex, even sometimes it makes some people more comfortable. So there's a lack of trust in some instances. Perfect example with the vaccine and the pandemic, but we won't go too deep into that controversial topic. But that's one thing, lack of trust. In terms of mindset, a lot of it is cultural,
Mhm.
traditions. I cooked a meal, a Sunday meal, if you will, today, and I was just thinking about how I prepared it and how much different the preparation process was and the ingredients that went into it compared to how my mama cooked. Now, mama's food was really good. But, at a certain point, both she and my dad, who had high blood pressure, they had to remove the salt. So it was already planted in my mind that too much salt isn't good for you, right? So a lot of it has to do with culture, tradition, sometimes again lack of resources, but just lack of trust of the healthcare your healthcare provider, or, that type of thing,
Hmm.
or going to see a doctor. I mean, you hear people saying, I don't believe in going to doctors. I have to say, I hear more from the males.
Yeah,
Sometimes I
yeah.
see where a patient when was the last time you went to a doctor? 10 years, 20 years, and it's like, wow, not even for a regular checkup. So not seeing the importance of, it's sort of like the mindset of ignorance is bliss, and that's not true. A lot of things are silent killers, hypertension in particular being one of those. I was
Hmm.
thankful that when I was diagnosed, I had some symptoms. I just didn't feel well. And knowing the history and what have you, I took my blood pressure and it was through the roof. I was under a lot of stress, just starting residency as an intern, or what have you, extenuating circumstances, but nonetheless, I was ushered into the hypertension club. And so I had to be very intentional about what I was going to do to make sure it was under control and I didn't progress to all those complications that I mentioned.
Very well said. Thank you for sharing that.
Mhm.
So another aspect is, the power of emotion. I know that many a times when addressing a particular culture,
Mhm.
and not to be critical of the
Yeah.
dietary habits or the food culture, but we have to look at the role of food that it plays in the detrimental health effects. And when you address food, people often take it uh, as if you were being offensive, right?
Mhm.
Because there's an emotional attachment to food and
Yeah.
food culture. So how do we get past that? How do we get past the emotion, the emotional aspect of, being offended, and actually see the bigger picture, which is to live a long and healthier life?
I think just education, really understanding, forums such as this, to understand the importance of making those changes, the statistics. I mean, African Americans in particular, we suffer more across the board,
Hmm.
underdiagnosed with so many things, undertreated with so many things. And so it's very important to understand, I would say emotionally, what are your core values? Let those core values, let the emotions that are attached to your core values work to your advantage, as opposed to, I've been doing this all the time and oh, it's not going to taste good if I, I'm just used to this. I crave it. I love it. Oh, that's rabbit food, or so opening up your mind to, hey, I want to live a long, productive life. Hey, I have some things to do. I'm still here in the land of the living. So there's something that God has for me to do. Knowing
Amen.
that it's temple, your temple, and you have to take care of your temple. It's what we use to serve, to live out our purpose. And if you don't, that's all we have, right? And
Yes.
so once the temple is destroyed, or there's no breath in it, we know what that means, right? So
Hmm.
for the time that we have, we really have to think. I think as we get older, at least I hope, you get a little bit wiser in that area and say, hey, I'm here for a reason. I want to optimize my temple as best I can so that I can carry out that reason, so that I can be around for my children, my grandchildren,
Hmm.
just do all the things that God has placed in your heart to do. There's a purpose, but there's a temple that needs to be strong to carry out that purpose. Now, mind you, there are some unfortunate diseases and conditions that come upon us, but even with that, all the more you have to have the right mindset to say, this, I'm not my diagnosis. I'm still going to make whatever adjustments or adaptations that I can to still be well. I have women in my weight loss program who they're not that ambulatory. There may be some concerns about even walking, which is one of the basic exercises that most people can do, but not everybody. But we can modify it and do exercises in the chair. So it's all about mindset, and to take away the I can't, or I'm not good at this, that, or the other, all the excuses. Uh, Again, we just want to learn to love ourselves. See, remember, God is love. We're made in his image, therefore we are love. And so we have to take care of what he created. We are a masterpiece in Ephesians chapter 2 and verse 10. We are
Hmm.
his handiwork. And so we have to give him credit that he made something good. He doesn't make any mistake. And we need to take care of what he created.
Amen. And
Yeah.
understanding how this thing called the body works is crucial.
Yeah. Mm-hmm.
Yeah. Now, in this process of healing and recovery, what are some negative thought processes that often hinder people, in your experience, that often hinder people or keep them from making the necessary changes in their lives?
Well, I think past failures, if you will, you aren't successful at something at a particular point in time, and therefore you kind of beat yourself up. Again, those can't, that I can't attitude, or I've tried this before and it wasn't successful. Even, certain habits like smoking. I talk to patients all the time who smoke. Oh, I've been doing this my whole life. I'm like, and that means what? There is nothing impossible. Guess what? You haven't had a cigarette in the last 5 days since you've been here. And in many cases, they don't even have a nicotine patch ordered. So you didn't die not having it, but what could happen if you continue in it? And some of them do say like, yeah, you're right. I've been okay. I'm try, or I'm not going to pick that up again. So you have to really, again, just change that mindset and be willing to, you're not going to change overnight. Habits don't occur overnight. It takes time.
Yes.
But with time, practice, encouragement, accountability, when you position yourself to be around like-minded people, that will help you on your journey. That will truly help you on your journey.
And that's very true. I read somewhere today that upwards of 80% of chronic diseases could actually be prevented altogether if we just focused on 3 areas, and that was diet, exercise, and quitting smoking. So if you made any sort of improvement in those areas, you're actually on your way to preventing a lot of these chronic diseases, or most of them.
That's absolutely true. And I see it in my coaching practice where the diet, the movement, when those habits are growing, my clients have more energy, mental clarity. I'm seeing the blood test that measures, for example, how well your diabetes is, that number improving.
A1C.
Yes. Cholesterol, that bad cholesterol, LDL decreasing, blood pressure, more, so you see all those things with the simple steps of movement, exercising, and as you said, if you are a smoker, quitting smoking.
Yes. Now, I want to learn a little bit about your coaching groups. What is your approach in helping clients? Because I know that as a physician, generally speaking, when people come in to see a physician for a particular disease, they often leave many a times with a prescription for a particular drug. And so the emphasis on lifestyle change, well, first of all, you don't really have time to get into that. Right? I think it's 12 to 15 minutes a consultation. So in your coaching group, what is your unique approach in helping clients beyond just giving them a prescription drug?
Very good question. I typically will start with helping them make the assessment. Okay, you go to a doctor, your doctor's assessing you, but you're working together. How are you doing? I usually like to use a short scale: mentally, physically, spiritually. And usually the lowest score, that's where we focus. But in that, even if it's getting 80% of the time spent, or the focus, or the planning to improve, we touch on those other areas. Because I think I said in the beginning, if I didn't, they're all interconnected: mind, body, and spirit. And so we do that. Once we make that assessment, then we can come up with practical steps to get you started, especially, for example, if you're inactive. Fundamental thing is, let's start doing something. My approach is, it's very customized in terms of what you like to do, what you like to eat, within the realm of healthy things to do and healthy things to eat. Movement is a healthy thing, so that there's really nothing there that should hinder someone unless they have some limitations for some other reason. So once we come up with that plan, things are scheduled, written down. There's reminders, and there's accountability, and there's camaraderie. When we're cheering for one another and not competing against one another. I know sometimes they have these biggest losers, So in this in this framework of how I work with people, we're all working together. One of my clients is like, we're one big happy family. She's like, we've just turned into a family here. And so I think that definitely goes a long way, because it's, we all need an encouragement. Yes. And so you don't feel that you're all alone, but customized, tweaking the plan, because the plan isn't stagnant, particularly when it comes to, let's say, weight loss. I tell my clients, you're going to lose a lot in the beginning when you go from zero activity to moving, when you start, eating a healthier diet, and then you're going to kind of plateau. And then we got to up it, we got to tweak it, and just keep going and look at where you are, say 2, 3, 4 weeks in compared to where you were before. And that mindset begins to shift, because you have this, the reward centers, you see the fruits of your labor of change, and you're like, wow. And it becomes this positive feedback loop. I can do this. And,
yes.
I won't call any names. I don't know if she's here, but she was one that said, oh, I don't like exercising. And she's an exercise junkie now. So again, that her brain is already being retrained. So again, customize, focus on a particular goal, knowing that the other areas will need to be touched upon, and making adjustments as needed, having camaraderie and accountability. Because I said those are the main ingredients. You have to have, motivation, accountability, and a plan. Those are really the 3 key ingredients.
How true. I think it's Proverbs that says, as iron sharpens iron, so one man sharpens another, which highlights the importance of having a group that'll keep you accountable and inspire and motivate you as well. So that's awesome to hear. I want to know a little bit about the spiritual health aspect, because I know in your course, you mentioned the importance of spiritual health. And I thought, that's interesting. Usually you hear people talk about nutrition or exercise or drinking more water. But, to hear someone emphasize the spiritual aspect, I'd like to know how you emphasize the spiritual aspect and the importance of spiritual health on overall health.
Yes, thank you for asking. I like to give examples, a lot of personal examples. So for me, again, I'm from Buffalo, New York. And when I tell even some of my patients, they're like, oh, Buffalo, oh, I know why you live in Georgia now, whether they've been to Buffalo or not. So I need sunshine. It really does something for me. I didn't realize how depressed I would be at times, that seasonal depression, until I moved to Georgia. But when I go on my walks or my hikes or jogs, whatever, some form of moving my legs outdoors, and I get the sun, I get these spiritual downloads many times, not every time. If there's some question I have or something on my heart pondering, and I really, I talk with God, I say he walks with me, he talks with me, and it really becomes a spiritual thing. And at the same time, I'm strengthening my heart, because we know heart disease is the #1 killer, women and men. Above cancer. So I'm getting the physical, I'm getting mental clarity. It helps with depression, and I'm getting that spiritual connection. Another aspect of spirituality, not necessarily within Christendom, but across other religions, is meditation. And so meditation is something that's important, that I encourage everyone to incorporate. And what that looks like for you, the basic meditation that I like to teach is breath meditation, where you focus on your breath. You focus on deep breathing, because we're all shallow breathers. Let's be honest. We're not really thinking about our breathing. So if you can somehow train the subconscious to take more deep breaths than what it normally does, it helps you on a cellular level, and it just reduces stress. I often go, when I'm doing a seminar, just have everyone practice deep breathing. That's a form of meditation there. As for Christians, you can focus on a particular scripture and repeat that, and just, sometimes we read the word, check box, I did that, but how about just taking a few verses and just marinating and meditating on that for the day or even the week? Doesn't mean you don't read other things, but that meditative process is also a very spiritual thing.
Well, thank you for sharing that. And I want to talk about, you mentioned the role of drama
Mhm.
in our lives, and it's something that we all experience, right? Drama is
Mhm.
akin to stress, if you will.
Yes.
What's the impact of stress or drama on our physical health?
Okay. Stress, we all have it. There's some form of healthy stress that keeps you motivated, but it's the distress, the unhealthy form of stress that's persistent, that raises your blood pressure, that raises the stress hormone level, cortisol level inappropriately, and that causes inflammation in the body. So we have to, again, find ways to decompress, to de-stress, like the deep breathing, the meditating, giving yourself the first 30 minutes of the day before you start your day. I say you want to start with 10 minutes. Whatever you have in your wellness plan, and hopefully it will be like a centering, meditative, prayerful time. It sets the pace for the day. In some instances, it might be exercising first thing in the morning, like I do with my group, for those who it fits their schedule. So whatever that whatever that looks like, to help you, set the pace. When it comes to relationships, oh gosh, I could write a whole nother book about that. So drama has to do with relationships, right? And I touch upon it in my book, about this drama triangle where you're either the victim, the villain, or the hero. I won't go into all the details. Get the book, you'll see what I'm talking about, right? And so
Mhm.
I always say that. So drama raises the stress hormone level. Again, it gives you GI upset, headache, all those things. So the mental and the physical, uh, it's so connected, right? I had a client years ago who was losing her hair, because of her strained relationship with her daughter. And it
Mm.
had more to do with what she thought her daughter should be doing at that stage in her life, not so much their interaction. So we had to really work on that. But again, you can reduce the drama stress when you resign your role. So if you're the victim, villain, or the hero, you just resign. You don't give a 2-week notice. You just say, I remove myself from this triangular communication or what have you, and you set boundaries so that you can reduce the amount of stress that comes from drama when you're dealing with any type of relationship, professional or personal.
Very true. And so that ties into mindfulness. What is mindfulness, and how
Mhm.
do we then apply that principle to our lives?
Okay, mindfulness is, I know it has been a buzzword, but it's a very good one. That's the name of my practice, Mindful Health for Women. But mindfulness is this ability to stay present in the moment and be consciously aware of what you're experiencing, even what you're thinking, without passing judgment on those thoughts. Being aware. And there's plenty of exercises that you can do to learn how to be present and in the moment. Same, connecting it even with, again, the outdoors, being at one with God, nature, all those things. So when you're being mindful, you're focusing on the present. You're not anxious about tomorrow, and you're not stressing about what happened yesterday or last week. Um, Again, when you are doing the meditation, that is a mindfulness practice. And there's all kinds of other things. When you sit here, even right now, you can sit here and think to yourself, is there any threat to your well-being in this very moment? Do you have enough air to breathe? Do you have clothing, shelter, all your basic needs? I'm willing to, I would gather that most all of us, we have a device, where you're using some type of device, to be on this call. So we kind of have more than what we absolutely need. And when you can have that mindset of assessing moment to moment, not dwelling on the past, doesn't mean you don't make plans for the future, but you get too futuristic. You're not right here and right now. So anxiety is about the what ifs, what could happen, may or may not happen that you may want to or not want to. And living in the past, again, doesn't help you. You can reflect on the past, and hopefully, as you grow and mature and do the work, because this whole self-care and wellness thing, it is work, but it's joyful, when you start seeing the fruits of doing the work. So you'll see the past as an ally. So we know what an ally is. So anything that's happened to you, any situation, you see it as the ally, perfectly designed to help you grow. What is it teaching me? What is it going to teach me to help me in the future? Okay. What lessons have I learned? How can I help someone else going through a similar thing? And so I'm sure we can all think of something that has happened or a transition or what have you that was extremely stressful during that season. But now that you're out of it, you can think about it, get the lessons from it, and not experience those same emotions. Same thing. You might be going through a storm today, but if you can stay present as best you can, that one day at a time, 1 hour, minute, second, just stay here. Focus on things that you need to do, but just do that. Be proactive. Don't worry about the outcome. Just stay present. And in the moment, that will definitely help you deal with the stress, along with those practices that will help you do just that, the meditation and what have you.
Thank you so much, Dr. Jones, for sharing those things with us.
Mhm.
I want to ask you, what points or what advice would you give us, those who are watching this, not only now, but in the future? What advice would you give them to apply in their current lives to really improve their self-care, their level of self-care?
Write it down. Make that assessment and say, what is it that I'm not doing that I need to start doing? What attention, what aspects of my wellness needs attention? And so if you start again with the eating and the moving, how much of that are you doing? How much how much fruits and veggies are you getting as opposed to the processed foods? How much exercise are you getting? It's recommended that you get at least 150 minutes per week or 30 minutes, 5 days, however you want to break it up. Minimal, moderate exercise to promote health and wellness. And so ask yourself, am I doing any of those things? And if not, start doing it, start planning. Let's go back to the eating. You can't eat well unless you shop well, right? So when you go shopping, they say stay on the periphery, all the goodies are on the inside, right? So the produce section and all that, let the veggies be the predominant food on your plate and a smaller portion of carbohydrates or protein or what have you. So I do a lot of education on that. Getting your antioxidant rich foods, the very colorful foods. Ask yourself, how colorful is my meal? Like today, I did have some kale greens. I had some red peppers, yellow peppers. I just had a lot of green, yellow, orange, and this, that, and the other on my plate. And I am a vegetarian. Doesn't mean you have to be that, but still make that a focus where you can get those nutrients and those antioxidants. Now, antioxidants, back to the inflammation, that can be increased from emotional upset, chronic disease, hypertension, diabetes, high cholesterol levels. It inflames the blood vessels. So when you eat the antioxidant rich foods, it helps reduce that. It helps to mitigate some of that inflammation. When you're moving, same thing. When you're resting, when you're de-stressing. So to get started, just ask yourself some of these questions, write it down, have your to-do list, and have yourself at the top of that list. Okay, putting yourself first is not selfish. It's essential because you cannot pour from an empty vessel. I hope you hear that.
Right. That's right. Well, you know what? When you're on an airplane, they often say that if, God forbid, oxygen pressure decreases in the airplane, you have to put your mask on first before you can put the person sitting next to you, put their mask on, right? Because if you try to put their mask on, you pass out, they pass out, you didn't help anybody. So you have to take care of yourself first before you can take care of others.
And that's why I say, try to do something for you the first thing of the day. I mean, I'm guilty of it. Sometimes you jump up and, there may be something that's not part of your routine, or you overslept, or just something that gets you a little off schedule. And by the end of the day, oh gosh, I didn't exercise. Now I'm too tired, So we're not perfect, but if you have a plan, like I said, you tweak it and make adjustments, because life happens, certain circumstances and situations that can upset the plan, but don't give up on the plan. Just adjust the plan. And also, you don't have to try to do it all in one setting, particularly with moving exercising. It might be 15 minutes in the morning and, 15 minutes before you go to bed. Just be creative in how you get that done. Walking the steps at your job, if they have flights of stairs, definitely the hospital has a lot of that. So sometimes I'll be huffing and puffing from the ground to the top level. Like, Dr. Jones, you're okay? I'm like, yeah, I just climbed the stairs. So you have to take those opportunities to just be mindful also of what is it that I need right now. One other saying is, each day ask yourself, what is it that I need today to be well? And give it to yourself. What is it that I need? Sometimes you're just tired and need a nap. Some people can't nap. I could sleep on at the drop of a dime at any time.
Me too.
So I don't have that problem, but sometimes you have intentions on doing a lot. You have a lot on your plate, and sometimes you just need to rest. Sometimes you need to unplug. That's another thing. Another tip is unplug. Some people get very stressed out about the things that are going on in the world. I could be more informed. I'm very ignorant in that because I rarely turn my television on. Very, very rarely. I mean that, unless someone's visiting me and they want to watch something. I do find out through social media, people talking, the most important things, but I don't stay glued to it. I don't watch anything that, I don't get into pop culture and other people's lives. I have enough to deal with my own life. So I just, unplugging, having that downtime, that me time, that's going to help with your overall wellness.
So I have a checklist of 7 steps that I believe are crucial to preventing chronic disease. And we've touched upon most of them. I think we touched upon inflammation. We touched upon the role of nutrition. We touched upon exertion or physical activity, and, restoration, which is rest and dealing with stress. But there are a couple that I want you to maybe elaborate on. What is the importance of elimination? So using the bathroom or having a bowel movement, as well as, yes.
All right. So you want to have enough fiber in your diet. You can get fiber from, again, eating more vegetables, and I do a mixture of raw versus lightly cooked or sauteed or what have you. So the fiber, drinking plenty of water. Now, there's no magic formula. I'm sure many of you have heard of drinking half your body weight. That's a good, thing that you can try, unless you're on some water restriction for other chronic conditions. Just try to drink water throughout the day. For those who are trying to lose weight, you can drink a glass of water 30 minutes before your meals to help with the satiety. So you have to stay, hydrated, and you have to have enough fiber in your diet for the elimination. Now, not everybody goes every day. The thing that you want to be most concerned about is if there's a drastic change in your usual habit. And that's when you want to talk with your doctor. If all of a sudden you're constipated and you haven't gone for a week or something, and you normally go every day, that would be something very dramatic. But plenty of water and fiber is going to help you keep yourself regulated.
Thank you for elaborating on that, Dr. Jones. So tell us a little bit about the Healthy Living course. You actually have a course that you offer to people, correct?
Yes. So the e-course, it's sort of a companion to the book, Healthy Living for Women. And I cover just some more mental health or emotional, psychological concepts to help train the brain. And I think I have I know I have clients that can attest to how their thinking has changed. Sometimes we have blind spots. So there's a short video. It's 5 weeks that each week you get a short video and a worksheet for you to work on a particular concept. It's not very time consuming, depending on how much you want to marinate over the content, 20 minutes, 30 minutes. When you get the information, and then work on it maybe 10 minutes, or just incorporating it into your daily thought process, depending on what topic I'm covering. So that kind of sets the stage again for behavior change, because again, healthy living for women is more than meets the mind and men. It starts in your mind, how you think, your mindset, and how you process your emotions.
And as for the book, where can we purchase the book?
Okay, you can purchase it on Amazon. You can just type in Healthy Living. I have a link. The best, easiest way that I can just describe it, if you can put it in the chat, is to go to my website, and it's easy to navigate. And there's a link that will automatically take you to Amazon, or you can type in the title and search for it that way. So Healthy Living for Women, it is on Amazon. My website is mindfulhealthforwomen.com, and that's with the number 4. And like I said, you can find it that way. We can find the e-course, book a free consultation, and all other information is all there as well.
And so for those who may be watching this at a later time, I just want you to know that I will be putting all these links in the description. Okay. So the links to the book, the course, as well as your website will all be included in there. Okay. For those of you in the audience who are new to the Self-Care Forum podcast, please be sure to go ahead and subscribe to my YouTube channel, because all of these interviews are uploaded there first and foremost. So how can we get in touch with you? How can people get in touch with you, Dr. Jones?
Okay, they can, again, go to my website and book a consultation. They can also send me an email at docindy@mindfulhealthforwomen.com. That's my email, docindy, DOCINDIE, @mindfulhealthforwomen.com, or just my website, mindfulhealthforwomen.com, either way.
So listen, I want to thank you, Dr. Indy Jones, for taking the time out of your busy day and joining us and just enlightening us as far as how to get to that healthy living. And so I thank you for just elaborating on your experiences, your motivations, what inspired you, and certainly some of the impact you've had on clients outside of conventional medicine.
Yes.
Listen to the audio version of the Self-Care Forum podcast on Spotify, Apple, and Google Podcasts.